session. With this, I want to finish here the introduction and hand over to Bernhard again, who will chair the first session.
Yes, so I'll try to make things very short to leave the maximum amount of time for the speakers. So our first talk will be given by Nuria Oliver. She's actually one of the people driving ELLIS, member of the ELLIS board, and also a fellow of one of our ELLIS, or active in one of our ELLIS programs. But in recent weeks, all her energy has been taken out by being a special, I don't know what's the title, special commissioner of the Valencian government to handle the COVID outbreak in Spain, and working on a range of projects in that area. So I won't say much about her background. She has a PhD from MIT. She has been engaging in various ways in machine learning, also for charities and public activities. And I'll give it to her now. Thank you. Yeah, you're muted.
Now it's like there was some kind of control that I couldn't unmute by myself. Okay, now I can do it. Well, thank you so much, and thank you everyone for being here. I'll try to go pretty fast mainly in my presentation. I'm just going to share with you how we are working in the Valencian region in Spain to use data and the analysis of the data to help make better decisions and help fight better the COVID-19 crisis. So as Bernhard said, my life before March 3rd was a very happy life, very involved with ELLIS, and particularly with the ELLIS units, together with Matthias, Betke, and Daniela. And I was just working hard on getting an ELLIS unit in Alicante, Spain, here started. But then the COVID-19 pandemic happened, and just reusing the previous slide, in case you haven't noticed, I happen to be in Spain, and Spain is this red line here, where you see our growth in the number of cases is pretty high, and the country is really struggling with how to combat the spread of the pandemic. I had worked in the past on epidemiological models using large-scale mobile data, because I have been working in telecommunications companies as a research director since the end of 2007. So I had a little bit of a deja vu, because I realized that data wasn't being leveraged to help us make better decisions, in the same way as it wasn't used in the Ebola outbreaks, or it wasn't used in the H1N1 flu pandemic. So I really thought about this, and I decided to take action. I wrote an article for one of the largest newspapers in Spain, and I contacted both my contacts in governments at various levels, and also my contacts, my old colleagues in the telco companies. And I sort of like tried to put together a team doing data science for the government in Valencia. So why to do that? Because we want to move to a policy-making situation where the decisions are made based on evidence. And the hypothesis is that the data is a reflection, of this evidence of an underlying reality. The data science team that we have created is a pilot for Spain, and the plan is to expand the methodology and the type of work that we do to the rest of the country. Our work was presented by, sorry, this is in Spanish, it was presented by the vice president, one of the vice presidents in Spain. We have a lot of vice presidents in Spain, Nadia Calviño, in a press release on the 27th of March. So why create such a team? As I told you, I've had a lot of experience working on infectious diseases and on the use of data for infectious diseases. And for many, many years, we've experienced a number of barriers that are preventing these technologies or these methodologies to be used in practical terms. So just a few days ago, a group of international scientists and practitioners, as you see on the slide, we published this paper where we highlight some of the key barriers that we have experienced and that prevent public administrations and governments from effectively using data to make better decisions. Because one of the main realities that the COVID-19 crisis has revealed is that decisions are being made without having evidence that this is the best, decision to make, or having partial, data. So why? One reason is because in public administrations and in governments, there is a lot of barriers related to capacity, to awareness, and to having a digital mindset. A lot of the public workers, they are not experts in data analysis. They don't have the digital skills necessary to be able to leverage, all this data. There is a barrier on accessing data, obviously, but there is also a lot of data available that could be useful. There might be certain concerns about privacy and data protection, but all the work that we are doing is fully aggregated analysis on anonymized data. So these concerns are actually really small. There is a big gap between the research community and the policy making and the decision making community. And there is also a gap in the maturity of the projects. So, now is not time to do research. It's not, at least if you are in an operational team, it's not time to come out with something, what if I do this or what if I do that? We have to deliver results every day by 5 p.m. So we don't have a lot of time to be experimenting. And then we've also realized that there tends to be a lack of preparedness for immediate organized action. And there seems to be all these, disorganized, decentralized, different ministries making different decisions in a not super coordinated, way. So what we've created is a data science organization, so to say, that is working directly with the president of the region. And I have structured it in 3 different teams. So we have a team doing mobile data analysis, which is aggregated mobile data coming from the mobile network, but also data possibly coming from other sources, like there are some companies that have mobile apps and they are willing to share aggregate data from their apps for the COVID-19 crisis. Then we have a second team that is working on epidemiological models that are able to build predictions on the number of infections with different levels of granularity, and both metapopulation, compartmental models like SAIR, or individual models. We have to produce predictions every day on the number of expected cases, hospitalizations, intensive care units, and deaths, but also predictions on how long the growth is going to last until we reach the peak, and what is the impact of the different mobility contention measures on the progression of the disease. And then there is a third team that is doing all sorts of additional modeling that is neither modeling mobility nor modeling epidemiology. We have different data sources. We have some health data. To date, all the health data is pretty very aggregated and not super sensitive. We have the mobile data, and then we have other data sources, as I mentioned. In Spain, this weekend, as a result of this activity, and obviously, other people might be also thinking on similar lines, and the European Commission is also pushing for this. They passed a regulation on Saturday by which the 3 largest mobile operators are sort of like mandated to share aggregated mobility matrices with the Spanish National Office of Statistics, which is the one that is going to be sharing it with us. So there is actually, they made it like a legal requirement to do this. So the teams, they have very similar skills. Everyone has a lot of expertise on data science, machine learning, applied like to data. But then depending on the flavor of the team, there are some additional areas. So the mobile data team is also building a lot of visualizations of this really large scale data. The epidemiological team needs to know about epidemiological models, and then the generic model team is more of like a generic machine learning, kind of team. So what questions are we trying to answer? So on the mobility space, we are trying to understand how has the mobility changed because of the contention measures? Have the interventions impacted mobility? What type of mobility has been impacted? The long distance, the short distance, the inter-province, the within municipality, and also, is that enough? Where should mobility, drop further? From a policy-making perspective, the spatial granularity that is the most meaningful in Spain, or at least in this region of Spain, is what is called health zones and health departments, because those are the the areas of competence of, or the way the healthcare system is structured in the region. So we are doing all the analysis at that level. I just wanted to show you a very quick visualization of some of the type of data that we're dealing with on the mobility space, and sort of like how you can see the, the different mobility between the different cities and parts of the city. And we can do that, at the zip code level or municipality level. The epidemiological team is doing relatively standard epidemiological work. So we want to be able to predict how many infected people there are going to be under different mobility scenarios. We're going to be able to determine whether the social contention measures are enough or not. And also we're trying to maybe even infer what are the main causes of infection. And this will bring me to one of the actions that we launched this weekend. And then the additional modeling team is doing other types of predictions, like, I don't know, predicting deaths or predicting intensive care, looking for new data sources for anything that could be helpful to help policymakers make better decisions. We have a meeting every day at 9:30 where a member of the president's office comes, the data protection agency comes, and all the data scientists in the team come. And we do that every day. So we work really, really closely, both with the data protection agency and also with the actual policymakers that are making decisions, about this. Even if we have all this data, we realized that there was data that we didn't have, and there were questions that we couldn't answer. For example, we didn't have any data about the social contact behavior during the contention measures. So how are people getting infected? What kind of behavior are people having during the social contention? Are people leaving the home? What are they doing when they leave the home? Do they know who infected them if they are infected? Do they know anyone that has been infected? Have they been in close contact with them? So all these questions, we didn't have any data about that. We also didn't have any data on the economic and labor impact of the COVID-19 crisis on people's lives. We didn't know exactly what the prevalence of symptoms is in the population. I think the $1 million question is how many people are really infected, because there are so many asymptomatic or slightly symptomatic people, and there are such few tests that the reported number of cases is really, really low when compared to the real number of cases. I don't know if you read the paper published a couple of days ago by the Imperial College COVID-19 Task Force, but that was one of the conclusions which was evident, for all the ones that were working on this. So we created this survey. I invite you to go check it out. We did that last week, and we decided to launch it in the weekend because we anticipated that new confinement measures were going to be deployed on Monday, which were. The survey is available in multiple languages. It's an anonymous, fully anonymous 24-question survey. We worked really hard to get it live before Monday, and we did that on Saturday at 8 p.m. Something completely unexpected to me happened, which was the survey became extremely viral. The initial deployment was in Google Forms. We kind of even collapsed Google Forms. In 36 hours, we collected 142,000 answers. I've never seen anything like this. The level of solidarity of the people and the engagement of all the people has been incredible. So Bernhard mentioned the fact that everything is going very fast, and the cycle is very, very fast. I can tell you as an example, this week, we deployed it on Saturday, and we've been working constantly to write the results of the survey, and we just finished the paper this morning, where we describe everything that people have told us, but also we draw 10 conclusions or 10 implications from the answers from people. I cannot go into detail, but if you are interested, I can send you the paper, and I love to hear your feedback about it. As I mentioned, the way of working is very intense. We meet every day at 9:30, and we have to have results by 5 p.m. every day. We have a common code repository. Everyone has signed, obviously, NDAs and code of ethics. We have very strict data access controls for some of the data. So not all the teams have access to all the data, because if they don't need to, why would they have access to that? And we deal with all the online team communication using Slack. And that's all I have time to share with you. So thank you so much. I encourage you to fill out the survey and to advertise it. It's a worldwide survey right now. and I'll be happy to take any questions or comments that you might have. Thank you.